So today we will talk about the using of physical and physiotherapeutic methods of rehabilitation. Rehabilitation is care that can help you to get back, keep, or improve abilities that you need for your daily life. These abilities may be physical, for example, mental and or cognitive thinking and learning. You may have lost them because of the disease or injury or as a side effect from medical treatment. Rehabilitation can improve your daily life and functioning. For example, patients with stroke have hemiparesis or hemiplegia, so it will be decrease of the muscle strength in the opposite side of the damaged brain area extremities. For example, in case of the lesion of the right side, will be left hemiplegia. And rehabilitation need to improve the muscle strength in the paralysis in the damaged extremities to improve the muscle tone because in case of the stroke will be increased muscle tone like the collapsed knife and because of this all this rehabilitation process needs to improve the abilities and they keep to can return to their work and improve functions for their needs. And for example, patient with mental disorders, for example, patient with dementia, needs the rehabilitation too to help them in their daily life. And for example, after trauma or after injury, and can be disabled, and they need the rehabilitation process too. Who needs rehabilitation? First of all, rehabilitation is for people who have lost abilities and they need for daily life. For example, some of their most common causes include injuries and trauma, including burns, fractures. It can happen, for example, in case of the broken bones, traumatic brain injury, and spinal cord injury. For example, patient with spinal cord injury becomes have the lower paraplegia, and so they have paralysis of their both legs. For example, this is in case of the lesion of thoracic level, of tetraplegia if you have injury of the cervical level, and this is tetraplegia or paraplegia. Next, this is stroke. As I told previously, will be hemiplegia on the opposite side. So decrease of the muscle strength in the opposite side extremities in arm and legs. So when we're talking about the side, one half of the body damage, it names the hemiplegia or hemiparalysis. When we are talking about the four extremities damage, it will be the tetraplegia. And when we're talking about the lower or upper extremities, it will be paraplegia. Next, this is severe infections. For example, COVID infections, pandemic, and all. After this, we need their pulmonary rehabilitation. All these patients needs a major surgery. Next, this is side effects from medical treatments. For example, in case of cancer treatments, certain birth defects and genetic disorders. And for example, this is patient with in childhood paraplegia, for example, they have next developmental disabilities and chronic pain, including back pain and neck pain. For example, a lot of people are suffering from the low back pain in the United States of America and in the European countries, and a lot of monies the government should pay for these patients, and next it will be drug addicts. Such patients need rehabilitation too. Rehabilitation methods and therapies. This includes, first of all, this is manual therapy, physiotherapeutic movement therapy, hydrotherapy, proprioceptive education, physical therapy. This is the cryotherapy. Next, ultrasound therapy, thermotherapy, and electrotherapy. Myofascial instrumental therapy, halotherapy, for example, light therapy, sun exposure, and speech therapy. What happens in a rehabilitation program? When you get rehabilitation, patient get rehabilitation, they often have a team of different healthcare providers helping you. They will work with you to figure out your needs, goals, and treatment plan. And the types of treatment they may be in treatment can include first of all, it can be assistive devices, which are tools, equipment, and products. They help people with disabilities move and function. Next type of treatment can be cognitive rehabilitation therapy to help you learn or improve skills such as thinking, for example, learning, memory, planning, and decision making. This is important for patients who's suffering from the brain trauma, so traumatic brain injury, patient after stroke, patient with dementia, with Alzheimer's diseases, and such patients need cognitive rehabilitation. Next, music or art therapy to help you express your feelings, improve your thinkings, and develop social connections. And there are a lot of research which make the decisions that combination, or for example kinesiotherapy and music therapy, make very good, all these good effect, have good impact, good effect for their disabled people, much better results, give much better results. Next, this is what we have, nutritional counseling. And it's very important for patient because some of the patient cannot eat by themselves, and they need to help to, and such problems should be decided because not adequate and deficit nutrition leads to increased mortality among the patient. Next, occupational therapy. Such therapy helps to the patient with their daily activities, and sometimes to they can return to their work, to their job, and this is very important for some patient. A lot of patients suffering from different disorders are young patient, and the whole life it's they should live, and to increase the quality of life, they very good if they can found the job depend of their physical and psychological problems. Next, physical therapy. This is very important type of therapy, and this type of therapy helps with to increase the muscle strength in the damaged extremities, to and to increase the mobility in joints, for example, and fitness. And there are a lot of studies which prove that physical therapy increases the neurogenesis in the brain and increase the impact of brain neurotrophic factor in the brain, and all this increase muscle strength, and what is more, it's all help for cognitive rehabilitation and decrease the depressive symptoms in such patient. Next type of therapy, it will be the recreational therapy. This is therapy is important to improve the emotional well-being of the patient, and this is very important because if the patient has depression and anxiety, the results of the rehabilitation will be much worse than if the patient is in good mind and have no depression or anxiety. And the for creational therapy, we can use art, crafts, games. Next, it will be relaxation training and animal-assisted therapy. Next, there are some items that most rehabilitation facilities allow or encourage the inpatient resident to bring with them. For example, clothes. Bring some seasonal or comfortable clothes, pajamas, for example, including and next, then they can bring shoes, for example, sleep on shoes, boots, without to be very, it should be good for these patients, and they can use them with their functional deficit. And next, for example, toothpaste, lotion, shampoo, all these, they should try to use by themselves. And hair dryer, feel free to pack a hair dryer and other approved hair products. Next, medication. Make sure that all prescriptions are correctly labeled upon your arrival. So upon patient's arrival, so because sometimes the patient can forget the name of the medications, or they can take one but should to take another one. So it will be should all correctly labeled. Identification in form, make sure you have patient have the identification and insurance card with them when they will be checked in. Money are very important to they can pay for treatment or other necessities, sentimental items. For example, a photo or someone of the patient's family, and journal or notebook, because the patient can write here some the thoughts, for example, and can record thoughts in them. This will help to the patient to reflect on both during and after HAP experience. Contact information of loved ones, so you can write them, for example, in case they should be involved in a rehab process, because the family should be involved in the rehabilitation process too. And envelopers to send letters of your family members, of their family members and friends. Rehabilitation setting can be the rehabilitation process. First of all, this is the hospitals. So it will be two types. This is inpatient and outpatient patients. Next, it will be the private clinics, where the rehabilitation process can be done. Institutions, for example, schools or even prisons, Rehabilitation centers, specific centers, community settings, for example, it will be individuals' home, long-term care, and workplaces. Things to leave at home when coming for rehabilitations. For example, the patient cannot bring with them generally the phone, computer, mouthwash, perfume, shoes with laces. And there are 4 phases of rehabilitation procedure: rest and protection. First, after the injury, the first thing that appears as a reflex is protection from further injury and rest. It is very important to elevate the injury body part, and to do so, it is advised to take proper medications. This phase likely encompasses appropriate rest and may include using ice or cold packs, some protective case, sling or tape of safeguard the injury, pain management with analgesic medication and or anti-inflammatory may also be considered. Number 2, recovery and motion. Any specific injury can initially pull you off from your motion. In that case, it is recommended to develop your pace or to walk again. Some exercises, such as stretching for a limited duration, muscle-related exercises, and joint exercises, can help this phase. Number 3, regaining and strength. In the second phase, the main concentration is on boosting your strength and patient strength and immunity, so that the injury body part can heal faster. In sports injuries, prevention from participation in training and game time for an expanded period is very important. Exercise like cycling, stationary cycling, pool exercise, and gentle exercise may be recommended. And recovery function as a last step in rehabilitation is recovering sport-specific function and return to play. For example, if we're talking about the sport trauma, this injury rehabilitation phase can include restoring coordination and balance, improving speed, sport-specific skill, progressing from simple to complex. This is the case in case of sport trauma. Next, we can here's the list of devices used in physiotherapy. So next step in rehabilitation process will be the using of different devices. This is electrical muscle stimulation. Next, ultrasonic therapy equipment. Next, this is the cervical traction device. We can use short-wave therapy, interventional therapy machine, combination therapy machine, TANS machine, phototherapy machine, biofeedback machine, cold therapy units, and staircase trainer, arm ergometer. On this in this screen, you can see the example of electrical muscle stimulator. This is electrical muscle stimulator, very important, and essentially this is like the electronic machine with the capacity to contact the muscle via electrical current pass through the muscles. And this is very important in case of the to improve the muscle strength and muscle stretching. And we can use this in case of the to treating muscle spasm, muscle pain, reduce swelling, and help heal wounds. And for example, in case of the paralysis or plegia, in case of the peripheral, we can put this stimulations, electrical muscle stimulation to increase the muscle strength in the damaged muscle group, and all this will improve the rehabilitational process, so it will be faster and more effective. Next, it will be ultrasonic therapy equipment. Ultrasound therapy is the use of sound waves to treat medical problems. For example, musculoskeletal problems like the inflammation from injury, different types of injury in the legs or hands. It helps increase the blood flow or localized area in order to reduce the swelling and inflammation in that area, and it is also used to enhance the healing of bone fracture. Another device which we can use in our rehabilitation process is the cervical traction device. And it can be used as a part of physical therapy treatment or on the own at home, for example. And cervical traction devices lightly strengthen necks to reduce pressure on the spine by pulling or separating the vertebra. Traction of the spine, it is also known as a cervical traction, and it is used in case of the neck pain and related injuries. Next, what we're talking about will be the short wave diathermy, and this is diathermy literally means hitting a throat. Diathermy is the controlled production of deep heating and under the skin, deep muscle joints for therapeutic purpose. And it is device used to plates that are placed on either side of the body, and it utilizes electromagnetic radio waves to convert energy to deep heat, and it may be molded to fit the part of the body under treatment. The application of moderate heat by diathermy increases blood flow and speed up metabolism at the rate of ion diffusion across cellular membranes. And fibrous tissue in tendons, joints, couples more easily strengthened when subject to heat and facilitating the relief of stiffness, for example, of joints, and promoting relaxation of the muscles and decrease the muscle spasm. Next type which we can use, it will be the interferential therapy machine. It is another device which we can use for an effective therapy option used by many physiotherapy clinics, and we use is to relieve pain, to accelerate the self-healing process, getting the body back to healthy pain-free state. And current therapy works by sending small amounts of electrical stimulation to damaged tissue in the body. And the therapy is meant to boost the body's natural process for responding to pain and increase blood flow and the production of hormones that promotes healing. Next, we can use a TANS machine. This is a transcutaneous electrical nerve stimulation machine. And this is the very effective and methods of which we can use in our rehabilitation process. And we can use this as an alternative to pain-killing medication, and it is a small, portable, battery-operated device which is worn to the body. For the therapy equipment. Next type of equipment, it will be the next type and of rehabilitation process, and we can use this program, use this physiotherapy device. This is a include halogen lamps, fluorescent tubes, and a system which with it's helpful in a situation with problem with the skin conditions. And for example, was one of the most important and serious problem with the skin, this is psoriasis, and this is phototherapy is very effective to prevent and to treat the diseases. Next here in this screen you can see the cold therapy units. Cold rush uses a brushless motor to produce a whisper required unit that allows patient to get the rest they need to properly rehabilitate from injuries, and it's small and only 2 kilograms. The cold therapy unit is a machine that circulates cold water through a bed to decrease the pain and swelling. Next, staircase trainer. This is another type of device, and it is one of the most important mobility equipment which we can use in physical therapies, and the ability to adjust the height of the stairs to the current ability and gradually increase the height between the stairs as the patient process is the key factor in the enormous success of this product. And this is therapy very important. Say care trainer in case when the patient cannot work properly, for example, in case of the spinal cord injury, when has a paraplegia, or in case of traumatic of their joints, for example, or in case of patient with hemiplegia, and they can use this staircase trainer to in their rehabilitation process. Arm ergometer. As in the arm ergometer's rest, the patient can sit or stand one while cranking the arm ergometer. The arm refers to as arm cycle or arm crank. Is available alternative to the treadmill or leg cycle ergometer for exercise testing. So, and in this photo you can see how it's look like. And for example, this patient, um, this patient this patient in this picture is using this type of device, and you can see how it looks like. Next, physiotherapy. From the Greece, you should know that from the Greek verb, physiotherapy and physio, it means nature, and therapy, this is another verb of this will be there to treat. So, fields of clinical medicine studying medical properties of physical factors, and developing the methods of their application for disease treatment and prophylaxis, and also for the medical rehabilitation. So this is a method of rehabilitation we used in our rehabilitation process in patient, for example, with traumatic injuries, um, with patient with for example, patient with nerve injuries, peripheral and local. And now we will talk about physiotherapy, physiotherapeutic factors influence. Physiotherapy physiotherapeutic factor influence can be, for example, first of all, it can be local, then distance, next or one distance, or another word with the reflex segment, and on the whole body. So we can use different parts, and such factors can influence on the different parts of the body. Which basic of principle of the treatment. This is the treatment is pathogenetic, but not etiologic. Therefore, the indicate for them are determined by not so much the etiology of illness, but its pathogenesis, predominance in pathogenesis, the processes of inflammatory or dystrophic character. And common contour indications for using for physiotherapeutic methods. Severe exhaustion, a difficult condition of patient, a risk of bleeding, tumors, next blood diseases, next cardiovascular or respiratory failure, disorders of liver and kidneys function, atherosclerosis, second, third stage of arterial hypertension, and active tuberculosis. Basic effects in tissues will be thermal and unthermal. Classification of physiotherapy methods after the era of influencing. So, general, yes. Next, local, reflex segmentary, and on biological points. Next, after localization. After localization can be superficial, so this is on the skin, yes. Intracavity, this is nasal, for example, mouth, ears, vaginal, and rectal. Intravascular, for example, laser, and intraorganic. So this is classification depend on the area of influencing and depend there after the localization. Then classification of therapy methods after the strength of contact. For example, contacts, first of all, this is contact, so it will be dense contact with the skin, for example, or mucous, and the second one, it will be the distance. Next will be classification of the after the technique or execution. Immobile and mobile. Harmonization. Harmonization, this is one of the methods of physiotherapy. We use we can use application of contact direct electric current of small force, 15 milliampere or low tension, 30, 80 volt with a medical purpose. With medical purpose, and next you can see here cathode and anode, how it look like, and because of this it will be cathode will be minus this is restrictive secret function of this anode restrictive use. We can use this type of harmonization in the case of the paralysis, paraplegia, in a patient with after stroke, for example, and next we can use this in case with, for example, we need to stimulate the hormone production and secretion, secretory effect and stimulating function, myotonic effect, vegetative, metabolic, and vasodilatative effect. So, if you need some type of this rehabilitation, we can use this type of physiotherapy. Next type of anode, this is a plus, will be it will be depress function, analgesic effects. For example, in case of the pain, in case of the association of it will be inflammation some years, and we need some analgesic effects. In these cases, we can use this type of rehabilitation and physiotherapy procedure. Next step where we can use this is hyposecretory effect. For example, we need to decrease the secretion, and in such cases, anode plus we put in this part of the body. Next, myorelaxation. For example, we have spasms, and when we have the spasm or increase of the muscle of the muscles, we can put here the anode and dehydratative. So next will be metabolic effect and vasodilatative effect. Local reaction. Local reaction, we have such effects in the place where we put a cathode and a anode. Local reaction, changes of cells hydration, yes, depend of a cathode and anode, plus and minus, changes of protoplasm color dispersion, and section, different changes of cell membranes, fasting of bloodstream, and increase the permeability of vessel wall. And we have both not only local reaction, but also we have the general reaction because of this method of rehabilitation. This is irritation of peripheral receptors. Nervous impulses are passed on different ways in the central nervous system, and complex reaction answers of organ and system of organism will be present. Now, when we can prescribe this type of procedure in case of the patients with, first of all, we can indications, first and second stage arterial hypertension, bronchial asthma, inflammatory processes of different localization, stomach and duodenum ulcers, and skin disease. Contraindication. One, common, individual high sensitiveness to current. And next will be damage of skin, skin diseases in the place of electrode application. And next, acute prolonged inflammatory processes and lack of pain sensitiveness. And I want to tell you the common contraindications. This is very important. The tumor, for example, yes, and we discuss it all this contraindication common previously. Next, placing of electrode transversal and longitudinal. And this is you can see how it looks like. And here you can see how we put anode and cathode on the skin of the patients. Next type of physiotherapy procedure, it will be the electrophoresis with medications. So this is the medical electrophoresis or electrophoresis with different type of medication with which we can use in the rehabilitation process of the patient. Of the patient. And we will talk about this introduction of medicines in human body with the help of the direct current. Two factors. First of all, it will be medicine and galvanic current. Next, we will. I want to tell you next. Cases for skin depot formation, shallow penetration of medication. For example, we need some part of the body in which part we can, this is all medication should make their function and have some results in their parts. Then this is the high properties of ion channel structural component of skin. Next, relatively low activity of metabolism and bad circulation of blood in the upper layers of skin. And in this screen, you can see the photo, how this look like. And advantages of medicinal electrophoresis, medical electrophoresis. First of all, medications are acted on the change by galvanic current cells and tissues. First of all, next is medication enter tissues, as joints, for example, they increase their pharmacological activity. Next will be formation of skin depot, prolonged duration of medications action. Next, the next advantages of the medical electrophoresis, it will be the high concentration of medications is created directly in a place of pathology. This is very important. So it will be not in circulating all medications the whole of the body, but this is important that it will the very high concentration of medication will be in the place of pathological process. Then the mucous membranes of gastrointestinal tracts is not irritated. And because why this is important, because a lot of different medication can inflammate our mucus of our brain and gastrointestinal tract, and because of this it's have a lot of medication has a lot of different side effects. And for example, the patient has the pain process or inflammation process, we should use the steroids and such steroid for ulcer effect of our gastrointestinal tract. And in case of the using of medical electrophoresis, the high dose of medication will be in place of pathology, but in the same time, the mucus of them our stomach will be not suffer from this pathological from these medications. Next advantages of medicational electrophoresis will be possibility of simultaneous using of a few medication is provided for example, from different roles, pools, from different pools. And next type of physiotherapy procedure is the Franklinization. Systematical methods in which the electrical field of high tension uses, and you can see the common and local Franklinization. Indications: functional diseases of the central nervous system, especially those that is accompanied by their irritability and disorders, for example, sleeping. This is or insomnia. Next, it can be used in case of migraine and in case of the head pain. Yes, next time this is we can use such type of physiotherapeutic procedures when we have the asthenic states and other like that. Indications. Next, it will be first and second stage of arterial hypertension. It's very important because a lot of people all around the world are suffering from the arterial hypertension, and unfortunately, the high blood pressure. This is very a big risk factor of strokes and heart value, a problem with failure, and because of this, very important to decrease the increase of blood pressure, and we can the people with such problems has should to drink some should to drink some drugs, but sometimes they can we can use another type of physiotherapeutic procedures, methods of rehabilitation, and one of them is this one Franklinization, and bronchial asthma, and trophic ulcers, infected ones, and ones with which are treated difficulty. And next, when we can use this, this is will be facial skin and mouth mucous paresthesias. So these methods we can use to this method of rehabilitation. But you should remember about the contraindication, and in such cases we cannot use. This is the common contraindications. First, then this is organic diseases in the central nervous system. Next, this is low arterial pressure. Next, for the local for local transplantation, contraindication is state during 2 weeks after the course of the rengenotherapy. And the common contraindication for using of physiotherapeutic methods, it will be first severe exacerbation of this some diseases. Next, exhaustion, next difficult condition of patients, so we cannot use physiotherapeutic methods. Next, risk of the bleeding, very important. Next, tumors, and this is very important to know because, for example, back pain or another, it can be symptoms of the tumors, but and you should be aware about this. Next, this is blood disease. Next will be cardiovascular and respiratory failure, disorders of liver and kidney function, and atherosclerosis. Second and third stage of arterial hypertension. So indications in it will be first and second stage, and third and second and third will be contraindication and active tuberculosis. This is a common contraindication which we cannot use in case of such patient. Now I will show you some video, small video about this how we can use the physiotherapy methods in our patients with different type of pathology, and when we are treating them in our when we're treating them in our hospital, in what is our rehabilitation programs. And now I will show you some small videos with of this patient, and now I will show you the rehabilitation process, how it looks like. And for example, it will be rehabilitation program with patient with, for example, stroke. Yes, I will show you how it will be looks like. And this is in a hospital, how different steps. There are a lot of different different type of programs and stroke rehabilitation. You can see, watch now this video. I will show you this movie, and this is will be video, this movie in the hospital with patients. And now I will show you my video. So this is patient after stroke, and you can see here how will be the rehabilitation process. And for example, this patient try to use, and you can see they use different type of steps. And we talk about the different devices which we can use in our rehabilitation process. And now you can see the patient with stroke, after stroke, and she is going, for example, first upstairs, and then she tried to go downstairs. So before this, such patient experience their and she should begin from the one step, from the one extremity. For example, it was right leg, and first step, then she should make all this with another leg, and all the time should be repeated. But you should remember that all this shouldn't be very severe. And now another another exercise. So physical therapist and help her and to stay on the one leg. How she can to stay in the one leg, because one leg was paralyzed, and now they are teaching her how to correct to stay in one leg of one extremity. So she tried to touch the leg on the right and yellow and different side. Next, another exercise they are showing how she should go through the cones, through different cones, and for example, she should go through them. But all this should be done properly because patients with strokes often have a different such its names them synkinesias. And another exercise, she tried to make another type of exercises of this patient. And why this? Because it strains not only muscles but balance of this patient. And next, they working with their arms and different exercise with their arm, but she cannot sit correctly. And the physical therapists are stay with her because she can fall down, and they should all the time to be all the movie should be made correctly. And now you're looking how it should be done, correct? Okay, this is one video I want to show you with rehabilitation program for this patient. This is brainstem stroke walk, and now I will show you another video with walking and tone, how correct management and stroke and spasticity after stroke, and how correct to should be stroke and to prevent the stroke of this patient. Now I will share this video from with this patient how correct should be done of this, and I make you can hear this, and now you can hear this walking and tone, the management or walking and tone of this patient. So
okay, Alan, so this is the stick you've been using at home.
Yeah.
It's called a tripod. It's got 3 feet on it, and it gives you a lot of support. I'd like to see how you walk with that. Just a few steps if you can. Okay, and stop there. So what I'm seeing is a wee bit like when we were standing up from the chair. You're taking a lot of weight through your left hand.
Yeah.
So that's actually meaning that you're not having to take so much weight on your right leg. What we're seeing is that it generates a bit of increased activity in your right arm.
Yeah.
Okay, Alan, I'd like to see if raising the height of this has any influence, because it'll mean that you can't take quite as much weight on the left arm. So it'll encourage your right leg to work a wee bit more. So I'm just going to raise this up a wee bit higher. Just pop your hand on here. Maybe just one more, just lightly on there. Okay. So just let your elbow come in by your side and just stay a little bit closer to it. Okay, Alan, so we've raised the height of that cane a little bit, so we'll see what influence that has on your walking. Okay, so just in your own time, you can take a few steps.
this is the gait of the patient with the stroke.
Okay. And I think we find that you're getting a bit more weight onto the right leg and a bit less weight on the left arm, so it's making you a little bit more symmetrical.
Yeah.
But you know what? I don't think you need a cane that's as supportive as that, so we'll try something else.
Okay.
Okay.
That's fine.
Okay, Alan, so this is a different type of stick. This is just a single point cane, and I've deliberately left it a little bit high, so that it's not so easy to push down on. Have a wee walk with that and see how it feels. Just in your own time.
There's a lot there.
That's certainly a much more symmetrical walking and more weight on your right leg, which is great. Okay. Okay, Alan, so we've tried a few walking aids. You're now wearing the ankle foot orthosis that was made for you. You also have a rest splint on your hand and wrist, which is helping to control the position of that. So what we'd like to try is using the same technique that you used for standing up earlier. Before you walk, I will try walking without the stick, but with the splint.
Fantastic.
So in your own time, if you'd just like to bring your weight forward from the hips, take your hands down towards the floor, and just when you're ready, come up to stand on both legs. Okay, just get your balance, get yourself nice and relaxed, nice and comfortable, and then when you're ready, let's just have a wee walk. So it's interesting that, we'll stop there, when you don't have to use your left arm, and your right foot and ankle are well controlled, your arm is much more relaxed.
Yeah, it's pretty much that.
And you're much more symmetrical.
Yeah.
So I think that's a better way of walking for you than using a a stick in your left hand if you can do that.
Yeah, definitely less restrictive as well.
Because you can use your left hand when you're on your feet.
Yeah.
Absolutely. So we've shown, I think, a good way of controlling the tone and the muscles on your right side while you're walking,
Brilliant.
which is going to be helpful for you, hopefully.
Thank you.
You're welcome.
So here you can see the rehabilitation process. In case of the patient with stroke, and you saw the picture of this patient, the photo of this patient, and I want to tell you that such patient has a lot of different therapy, different problems, and what more, what is important that another video will show with kinesiotherapy taping, and it will be the ergotherapy with kinesiotaping. And the last one video I will show you when we can use the physiotherapy method, when we can use ergotherapy methods, and for example, this is using for the hands. So this is kinesiotaping, which is the therapist, physical therapist used for this patient. Yes, and then they put this all on this damaged skin, damaged hand of this patient, and then this patient will take their put how correct to put. This is ergotherapy. So they try to learn their skills which he lost during the stroke. So with physiotherapist, with ergotherapy, this ergotherapist, and she learned him how correct to do this, and with it kinesiotaping on the hand or his hand. So you can see like a process, like this process look like, and in time, and then they give him different exercises, and this patient should do all this properly. Okay. Okay, so we finish our lecture. Thank you very much for your attention. Goodbye.